Hi everyone, I'm Dr. Kate Cam and I'm an aesthetic dermatologist. Today we will be talking about pimples or acne. This video is part 2 of the 2 videos that I made to cover this topic. In my first video, I talked about the causes and the medical treatments available for acne. If you still haven't watched my first video, the link to it is in the description box below. Moving on with the physical modalities for acne, we have acne surgery or physical extraction, chemical peels, cryotherapy, intralesional corticosteroids, electrocautery, incision and drainage of cysts, microdermabrasion, lasers, and other light-based treatments. For acne scars, in addition to chemical peels and laser treatments, we have microneedling, dermabrasion, soft tissue fillers, punch excision, elevation, grafting, and subcision may be done. First, let's talk about acne surgery. It includes comedone extraction, which is a quick and relatively simple procedure that, if done correctly, should not lead to any residual scarring. It is done using a sharp blade or a beveled large bore needle to lightly pierce the epidermis. Using a comedone extractor, pressure is then applied to the lesion until all the contents are expressed. It is important that the contents are completely taken out. If the pimple is large or what we call cystic, a surgical blade will be used. This needs to be done in a sterile manner to avoid infection, and then anti-inflammatory and antimicrobial agents are used after the procedure. Next, we have chemical peels. It involves the application of chemicals to cause controlled epidermal and dermal damage, which leads to skin exfoliation. They are categorized as superficial, medium, and deep peel, and that is according to the depth of skin damage they produce. These peels can be used for the management of acne, and medium and deep peels can be used for superficial and deep acne scars respectively. Chemicals used includes alpha-hydroxy acid such as glycolic acid, lactic acid, citric acid, and also salicylic acid, trichloroacetic acid, and phenol. Peeling of the skin leads to decreased whiteheads and blackheads, and also it evens out skin pigmentation and may help improve acne scars. Cryotherapy involves the use of a cryogen, for which liquid nitrogen is the most commonly used. There are many methods to using cryotherapy, including the spray freeze, applicator, cryoprobe, and thermocouple method. Cryotherapy causes cell injury during the thaw after freezing the cells. It may be used for cystic acne where a 10-second freeze-thaw cycle is done. It may cause the treated area to lighten though, so extra caution is needed if we're going to use it for darker-skinned individuals. Then we have electrocautery, which uses electricity to create heat on the tissue. The use of this creates an opening where contents of the comedone may be discharged and may also stimulate the immune system to clear the pimple. Microdermabrasion involves the use of ablative crystals or diamonds, hence the term diamond peel, to remove the outermost layer of the epidermis, the stratum corneum. Younger skin then replaces this layer. It enhances the penetration of topical medications in addition to its cosmetic benefits. Immediate results are seen, including softer skin, better texture, and decreased visibility of pores. Lasers and light-based treatments for acne targets C. acnes, reduces sebum production, and also has anti-inflammatory effects. The bactericidal effects of this light-based treatment stems in their ability to be absorbed by the products of C. acnes deep in the follicle and the subsequent production of free radicals. They are also able to affect the sebaceous glands in a way that sebum production is decreased. This modality has the greatest effect on mild to moderate inflammatory acne. Intralesional injection involves the direct injection of corticosteroid in the pimple. This treatment is beneficial for those large inflammatory pimples, resulting to its dramatic flattening, usually in a couple of days. Among the modalities I mentioned, acne surgery, cryotherapy, electrocautery, and intralesional injections are useful for pimples that are already there, but they do not prevent more pimples from coming out. They are mostly done to hasten the resolution of pimple to prevent scarring. Moving on to the treatment of acne scars, let's first talk about microneedling. It is also known as skin needling or collagen induction therapy. It is done using a rolling barrel with tiny needles over the skin, which creates multiple punctures and stimulates the healing process and hence collagen production. Subcision or subcutaneous incisionless surgery are done to elevate depressed acne scars. Needles are inserted parallel to the skin and is rotated in a fanning motion to loosen fibrotic adhesions that are binding these pimples. This creates space where collagen can deposit. For very deep scars that reach up to 2 millimeters in depth, punch excision may be done. It involves the removal of the scar by a punch biopsy tool and is then sutured. A graft may also be put in place. Depressed acne scars may also be augmented with fillers such as hyaluronic acid, calcium hydroxyapatite, and also autologous fat transfer. And then there is dermabrasion. It involves the peeling of the entire epidermis and down to the deeper layers of the skin. This procedure is highly operator dependent and can result to significant scarring in untrained hands. This, in addition to post-operative pain and a long downtime period of up to a month, makes this a lesser used procedure and had been largely replaced by resurfacing lasers. And finally, we have laser resurfacing. These lasers work by targeting water in the tissue to produce heat injury, stimulating collagen production and skin retraction. This tightens the skin. Ablative lasers, or those that vaporize tissue, tends to be more effective and with more dramatic results than non-ablative lasers. Fractional lasers has also been developed, which reduces the trauma to the skin, but still maintaining good resurfacing efficacy. There is a lot to learn about lasers, so I will talk about them more in a separate video. So there you have it for acne. If you have any questions or comments, or if you have any topics that you'd like for me to talk about, please comment below. And if you like this video, don't forget to subscribe. Thanks for watching.